You know, there's a hospital right here in Connecticut, Farmington to be exact, that has a whole entire program dedicated to the transgender population.
Yeah, and since it is Pride Month, we decided to learn more about the department helping folks make a life-changing decision. Scott
sat down with Dr. Pooja Luthra, Associate Professor of Medicine at UConn, to find out just how dedicated the team is to helping people. Take a look.
I'd like you to meet Dr. Pooja Luthra. She's an endocrinologist with UConn Health in Farmington. They have a fairly new department here at the hospital helping people transition from male to female or female to male, whatever their preference may be.
It's a sensitive topic. Right. Coming here and, you know, people are emotionally going through a lot of things, but then physically they want to come here to, and they want to have changes made. You're the first step.
That's correct.
Tell me a little bit about that.
So we have a transgender program here at UConn that we try to provide an inclusive and safe environment for our patients. We know that historically transgender care and access to care has been limited, and people don't access that care because of previous discriminations.
This is a safe place to come and discuss the changes a person might be thinking about. Once someone makes the decision, here at UConn they have cutting-edge technology to help their patients. So much to offer.
We can help the patients with their transition, whether they desire to be trans-feminine or trans-masculine. So we hope to be able to provide those services here.
Even if you're just thinking about the decision, Dr. Luthra can help. Again, she's the first person here at UConn you would see.
Where does one start if they're interested in the process?
Right. So, you know, they can obviously start talking with their primary care physicians if they want to explore their gender identities. If they're seeing a mental health professional, talking to them would be important. They can make a referral to our clinic, and then we can discuss, you know, what their needs are. Every patient is an individual, so what their desires are. Not all transgender individuals seek all gender-affirming interventions. Some people may seek only hormone therapies. Others may also want to do surgical interventions. Some people don't want to do any of those. So it really depends on what the individual's needs are, and we can walk them through that process.
A process that could include things you might not think about, like ear, nose, and throat surgery, pelvic physical therapy, general urological care, plastic and cosmetic surgery, gynecology, and ophthalmology.
We also offer other services like voice coaching, again, so that the patients can appear more feminine. You know, it's the voice is the first thing that we use to identify ourselves.
It's such a huge decision.
Correct.
Are they going to get emotional support as well as physical support here?
Correct. So you know, a lot of patients have what we call gender dysphoria, which is the distress that patients feel when when their gender identity is different from their sex assigned at birth. A lot of them are already seeing mental health physicians. We do encourage them to continue following up with mental health providers in the community.
The clinic treats patients 18 years and up, and required sessions with a mental health provider are no longer required.
We don't require. There used to be something called a gatekeeping model in which patients had to see a mental health professional and then get gender-affirming hormone therapy. We use the informed consent model in which you can talk to a mental health physician, but we can make the diagnosis of gender dysphoria. So the gender dysphoria, which is a psychological distress that a patient feels when their gender identity is different than their sex at birth, any physician can make that diagnosis. So we don't require them to see a physician. Mental health physician. However, the distress that patients have, and they have a lot of other mental health issues, depression and anxiety that stems from the dysphoria, it's helpful to see a mental health professional,
but
so
not
they can
required.
support them right through the process.
UConn, an inclusive place to come for all individuals.
You have to feel gratifying in your profession to be able to help people transition.
It is wonderful to see patients as they're going through the transition, you know, the changes that happen, which are initially very subtle, and then, you know, you can see them a year later. It's heartwarming.
And if you'd like more information on transgender issues, please reach out to the wonderful staff at UConn by heading to their website. It's health.uconn.edu.
And thank you to Dr. Luthra for sitting down with us. She is a delight. Scott had a blast.